Hello, my name is Sarah Tackett and I'm a health educator. Today I will be discussing suicide rates in adolescent girls. Due to the prevalence of bullying, mental health issues, and the lack of knowledge about available treatments, suicide rates have nearly tripled in adolescent girls in ages 10 to 14 years old. The rate of suicides in girls ages 10 to 14 has tripled in the past 15 years, from 0.5 per 100,000 to 1.7 suicides per 100,000. Contributing factors to suicide are mental health disorders such as depression or bipolar disorder, a family history of suicide or depression, physical or sexual abuse, bullying, no support network, or struggling with their sexuality. This is the description of the issue using the socio-ecological model. At the individual level, we can help by using antipsychotic and antidepressant medications such as serotonin reuptake inhibitors. Research has shown that SSRIs can be beneficial to children and adolescents that have depression and thoughts of suicide. There has been concern that antidepressant medication can cause an increase in suicidal thoughts, and although it is very rare. It can also hinder on the individual level. Victims of bullying and suicide are very closely linked. Almost half of suicides in adolescents ages 10 to 14 are to bullying. Bullying is also associated with mental health disorders, including victims of bullying and the person bullying as well. Bullying can also end in injury, social and emotional issues, and problems in school, and can cause distress in schools and communities. Help on the interpersonal level is social support, and it is very important to a person's mental health. If a teenager has a good social support system with close family members, friends, teachers, and coaches that they can trust and talk to, the risk of suicide is low. Friends and family can be a major source of support and can help decrease the impact of stress. This is especially true for adolescents, where there is still a high level of dependency. Something that can hinder on the interpersonal level is physical and emotional abuse from a family member. Abuse can cause emotional stress, depression, and suicidal behavior in people, especially adolescents. Adolescents who have experienced childhood neglect or abuse have a much higher risk of suicide than other teens. Something that can help on the organizational level is training and education from primary care professionals to recognize signs of depression and other mental health issues. And something that can hinder on the organizational level is media reporting, and social media use can sometimes make suicide look appealing and can increase risk in suicide, especially in teen girls. Media outlets can report inappropriate information about suicide, including suicide fads in teens or sensationalizing movies about suicide. The internet can also be a risk factor. It is the #1 source of information about suicide. On the community level, crisis helplines can be helpful. They can be accessed by phone, and they're also now offered through internet chat. This is a great tool where teens can seek help and support when social support or professionals are not available. Crisis hotline interventions have shown to be effective in helping critically suicidal people and lowering suicide risk with callers during the sessions. Restrictive access to health care can hinder on the community level. Having effective health care and the ability to be seen quickly is critical in order to reduce the risk of suicide. The stigma associated with suicide and mental health issues also hinders a person's ability to seek medical care, especially in adolescence. Suicide surveillance can help on the policy level. Suicide surveillance on suicides and suicide attempts can help in planning, implementation, and evaluation in public health practices. Surveillance provides data collected systematically that can educate targets for interventions and creation of new policy initiatives. Easy access to deadly means can hinder on the policy level. Suicide by using a firearm accounts for most suicides in the United States. Firearm restrictions for home ownership and reduced suicide rates has been correlated in many countries. Creating legislation and regulations to make stricter gun laws in the U.S., for example, mental health screenings and extensive background checks before purchasing guns, limiting the types of guns available to buy, and enforcing storage laws. There are three proposed interventions in order to reduce suicides among adolescent girls. The first is school bullying policies. These policies can influence behaviors for everyone involved. The policies can be implemented to prevent negative behaviors and can specifically target the adolescent female population. They are important to create strategies that will aim to reduce bullying and harassment in adolescent girls. The next is collaborative care to manage depressive disorders. Collaborative care is a multi-level healthcare system intervention that utilizes case managers to connect primary care providers, patients, and mental health specialists. This intervention will be adapted to be used with adolescent girls in multiple ways. A case manager will help primary care providers and patient education follow-ups to track their depression outcomes, and progress with treatment and adjusting treatment plans when needed. Case managers will also help with primary care managers to look for risk factors for depression and suicide in girls. Last is school-based suicide prevention programs. This type of intervention is aimed at the majority of adolescents. Suicide prevention programs can be implemented in secondary schools aimed to the adolescent population. These programs can target all adolescents. A specific group that may have one or multiple risk factors for suicidal behavior, or even an individual that may be at risk for suicide. First, training for adults that work with adolescents, such as teachers and school counselors, that will teach them how to identify students that may be at risk and get them the help they need. Another program is peer support, where students are trained and given leadership roles where they can identify and support their peers that may be at risk. Suicide awareness education is short-term in the classroom to give information about suicide and how to look for risks of suicide in themselves or their friends. In order to evaluate programs to see if they were successful, it is important to collect baseline data through questionnaires and suicide risk screenings, satisfaction surveys pertaining to participants' thoughts on the programs, measuring participation, pre- and post questionnaires about how students deal with stress on their ideas on suicide. The outcomes that are desirable from the programs are a better school environment, increased awareness of suicide and the harmful effects of bullying, more availability for mental health care, more adolescents reaching out for help, more intervention opportunities. Some potential challenges that may come up during implementation of the program is inadequate funding, time, support from important non-staff members such as parents, students, and community members, the proper tools to support the policies, available competent professionals, clinical barriers such as patient communication or lack of knowledge from physicians. The logic model shows the inputs for or resources needed, the activities that are the interventions, the output, what needs to be done to implement the program, and the outcomes, what the programs seek to accomplish. The logic model seeks to show progression towards the goal, the impact, to reduce bullying, reduce suicide attempts, and ultimately decrease rates of suicide in adolescent girls. Remember, suicide is preventable, and it is critical that suicide prevention is a health priority, especially for young girls ages 10 to 14, where rates continue to climb.